My name is Joe Kolars. I'm the Executive Director of our Center for Global Health Equity. And I'm really pleased that our center has a chance to partner with our School of Public Health, our School of Environment and Sustainability, our nursing school, in trying to really bring together a conversation about climate vulnerability in health. Our center is about 3 years old. This particular symposia coincides with our executive advisory board. So we've brought in some luminaries from around the world that are actually going to participate in a panel discussion on what should great universities like ours be doing in light of the climate crisis that's in front of us. So I'll be introducing that later. First, what you're going to hear is some presentations from our challenge group within the center that focuses on climate vulnerability in health. So that particular group, our center, we have about 350 members representing 18 different schools, and we bring people together creatively for impact. So one of our challenge groups, again, Climate Vulnerability in Health, and it's run by Professor Joe Eisenberg, who is in the School of Public Health, Department of Epidemiology, with a number of other appointments, who's in partnership with a Professor Sue-Ann Bell from our School of Nursing, who's really dedicated her career to this space. And the two of them have been bringing people together, again, in different creative ways. So I'm going to turn this first session over to them, where they're going to be introducing some lightning talks to try and get the conversation going before we bring up our panel for a discussion. So Joe, Sue-Ann?
Welcome, everyone. It's my pleasure today to bring together this group of 5 incredible scholars from University of Michigan whose research highlights climate change and health-related work and innovation across disciplines and levels of engagement. So in the interest of time, we will introduce each speaker with their name and title, and we direct you to the QR code that you'll see on the screen for their full bios. So, could I invite Jennifer Head, our first speaker? Dr. Head is Assistant Professor of Epidemiology, whose research focuses on endemic fungal infections, emerging and zoonotic diseases, climate and health, and mathematical and statistical modeling. Thank you.
Thanks so much for that introduction. Really excited to be here today. So a recent study has found that over half of known human pathogenic diseases can be worsened by climate change. And one class of human pathogenic diseases that receives relatively little attention but has a large global burden is human pathogenic fungi. In 2022, the World Health Organization released the first ever list of fungal priority pathogens in response to evidence that fungal pathogens were adapting to warming temperatures and expanding in their geographic range. In the 5th National Climate Assessment Report, which was published in 2023, the emergence of fungal pathogens were included as regional examples of how climate change is harming human health. And this is shown in the graph on the bottom left, where you can see the fungal pathogens in the green circles. Fungal pathogens are of special concern because we have no fungal vaccines and there's rising antifungal resistance. My work is considering the ways in which climate is affecting one of these human pathogenic funguses, Coccidioides. Coccidioides is the causative agent of coccidioidomycosis, which is also called valley fever, a disease which is rapidly expanding across the southwestern US, as well as parts of Mexico, South America, and Central America. In the environment, coccidioides grows, as you can see here, in these long branching chains that can fragment and release spores. Inhalation of these spores can cause respiratory symptoms in otherwise healthy individuals. Climate can influence many parts of this transmission cycle, and my group is seeking to understand how sequences of meteorological events affect this process. We're also seeking to understand the climate and environmental forces that lead to the aerosolization and the transport of these spores. And we're producing new evidence for the role that non-human hosts play in determining where the pathogen lives in soils, both by adding nutrients to the soil and potentially spores back to the soil. So first, we partnered with the California Department of Public Health in order to understand patterns of incidence within the state of California. We were first able to demonstrate that wet winters followed by hot and dry summers are amplifying incidence, and second, that cycles of drought and heavy precipitation are also amplifying incidence. The graph shown on the bottom left here is based off of our published work, and it's showing that valley fever incidence is quite low during periods of drought when moisture and nutrients are potentially insufficient for Coccidioides growth. However, when rains return following drought, we see major spikes in the incidence of valley fever, and these spikes more than offset the declines that occurred during the drought. This graph ends in 2020, but we know that some pretty extreme swings between drought and precipitation happen following that. And this swing between extreme drought and heavy rainfall is becoming increasingly common under climate change, both in the US West as well as many parts of the world. So you can see in the pictures shown on the right here that the period of 2020 to 2022 was characterized by extreme drought in California. And then at the end of 2022 into 2023, there are some pretty severe atmospheric rivers that dramatically changed the landscape and gave Coccidioides the nutrients it needed to grow. Accordingly, we anticipated that 2023 would be a major year for valley fever incidence in California, and we worked with state health to promote this messaging to physicians as well as the public. And indeed, we'd see that 2023 was the largest year on record for valley fever in California. And we note that the atmospheric rivers continued at the end of 2023 into 2024, so we're anticipating already that 2024 will be a similarly high year. Our work is also seeking to understand how spores are aerosolized and transported through the air. We use both statistical models that analyze incidence data as well as field analysis of air samples. So as just one example of this work, there's concern that wildfires in the Southwest are mobilizing massive quantities of soil and spreading spores of pathogenic fungi. We've used our statistical models to identify certain fires where increases in transmission may have occurred following the fires. We're also partnering with the EPA and other universities to test out new methods for the airborne detection of spores. As you can see in the figure on the left, we're using unmanned aircraft systems where we're able to isolate Coccidioides in as little as 160 liters of filtered air, which is a major breakthrough given that prior research required tens to hundreds of thousands of liters to detect these spores. And so this is enabling us to break new ground in understanding point sources of spore emissions. Finally, we're conducting longitudinal field studies to understand where Coccidioides lives and grows in the soil. Since 2020, we've been collecting soils from an experimental field site that's shown in the picture on the left that is experimentally excluding rodents from certain areas. Through our soil sampling, we've uncovered new evidence for the role of small mammals and their burrows in determining where Coccidioides is in the environment. As shown in the bar graph in the middle, we consistently detect high rates of Coccidioides in burrows with rodents, but lower rates of detection in burrows without rodents, and even lower detection among surface soils. These analyses challenge prior thought that Coccidioides is consuming plant matter in the soil, and instead suggest that Coccidioides is preferring nutrients from animals. What we've learned in California is helping us examine climate-related effects of fungal pathogens in other parts of the world. So we're quite interested in understanding the emergence and spread of blastomyces species, which causes blastomycosis, as well as histoplasma species, which causes histoplasmosis. Thank you for your attention, and I'd like to acknowledge a large community of collaborators in this work.
So our next speaker is Paige Fischer, who's an associate professor in the environment and sustainability. Her research focuses on human adaptation to climate and natural hazards such as wildfire in forest areas.
Thank you. Okay, let's see. Something happened with my slide. Thank you very much. Today I'm going to share what I learned during recent exploratory research on wildfires and community well-being in Chile, supported by a Fulbright Award. So in Chile, as in many forested regions around the world, fires are becoming more damaging and more frequent and more severe. And, sorry, I'm just adjusting my slide here. Okay, can't do that. And that's because climate change is driving drought and heat into, and therefore fire, from historically fuel-limited systems like the Mediterranean up in the upper part of this figure into drought-limited systems. Historically drought-limited systems like a more productive conifer and deciduous forests in the lower part of this figure. And in this increasing wildfire risk is occurring on a backdrop of land cover change driven by the expansion of plantations. Since the 1974 Pinochet coup and the country's subsequent reorientation around a neoliberal economic agenda, plantations have expanded south and eastward, and focusing on two highly flammable species, eucalyptus and radiata pine. And it's well recognized that wildfire risk burns in a geographic pattern that's very similar to that of plantations, as you can see from this figure. The result has been a series of large destructive wildfires, and along with those wildfires, extreme smoke events. And we know that smoke causes far more damage in terms of human health than wildfire itself. And this wildfire risk does not occur on a backdrop of a homogeneous local landscape or a homogeneous social landscape. Incomes are much higher in the northern part of south central Chile, whereas proportions of original peoples and rural populations are much higher in the south. And notably, the Pinochet administration privatized significant amounts of communal land for the purpose of creating plantations, especially and most controversially in the southernmost portions of the Biobío and La Araucanía regions, which are the historical homelands of the Mapuche Indians. So as wildfire risk worsens in Chile, lower income, more rural, and more indigenous communities disproportionately suffer the effects. I documented the geography of wildfire risk during my 3-month sabbatical trip in Chile. I arrived on March 1st, directly after a devastating 22-23 wildfire season. It's during my stay, I spent 3 weeks visiting communities, 8 communities affected by those wildfires. Moving from north to south, I'm going to describe some of those communities and their wildfire risk conditions and how their efforts to reduce risk turned out to be futile because of their embeddedness in a landscape beyond their control. Starting in the north, in Oasis La Campaña was a community surrounded by a national park. The residents couldn't directly influence wildfire risk on those public lands, but as ex-urbanites and former professionals with substantial financial and social capital, they were able to organize themselves to reduce flammable vegetation around their homes and around their buildings and equip their own internal firefighting force. And as a result, they have not experienced a wildfire in their community. Moving further south to Villa Cumbres, which is an unplanned community of day laborers whose community is surrounded, that's perched up on ravines that are full of wild vegetation where people throw garbage and are surrounded by abandoned plantations, so eucalyptus plantations. They have no influence over the conditions of the land surrounding them. Although they spent enormous time and energy reducing fuel and creating defensible space around their homes and buildings, they lived, from what I heard, talking to them, they lived in fear of wildfires burning into their community and were almost burned out by the February 2024 wildfires that killed more than 130 people in their region. Moving further south, Nacimiento is home to a pulp mill owned by a plantation company that controls all the surrounding land around the community. The 2023 Santa Ana fires burned across this landscape and devastated hundreds of farms and woodlands, leaving rural poor people without a source of livelihood. When I talked to one family who had lost everything, they plan to rebuild their homes and outbuildings and replant their own woodlots of eucalyptus and radiata pine because this is what government incentives allowed them to do. Finally, in the communities of Huanatipi and Villacuehueco, these are Mapuche communities surrounded by plantations owned by national and international corporations. They have no influence over the management of these plantations, despite the fact that they are located on their former homelands. One community leader said his community had offered to do some management to reduce wildfire risk on one of the plantations, but received no response. The plantation burned in 2023, along with many of their crops and livestock. The pattern I witnessed moving from north to south was indeed one of increasing wildfire risk, increasing rurality, increasing original peoples, and decreasing income. The government of Chile is responding to the wildfire problem with various policy and programmatic initiatives, yet communities continue to experience declines in well-being due to the wildfires despite these programs. And this is because the programs treat wildfire as a natural disaster that communities need to be resilient to, rather than a hazard that communities have created directly through land use policy and practices and indirectly through anthropogenic climate change. At the heart of this public health crisis of wildfire and smoke is a tension between policy efforts that promote national economic growth over local community well-being. And this policy conflict is trapping individuals in a repetitive loop of preparation and recovery, where they are asked to be resilient to wildfire risk created by others and that benefits others. The solutions to the fundamental problem are not easy. They require transformational change in social and ecological systems, specifically land use regulation to reduce the chance of wildfires spreading from plantations into communities, regulation about how plantations are managed to prevent fires from breaking out in the plantations and becoming intense within the plantations, and land reform and other policies to provide communities with more opportunity to influence how plantations are managed so they have some control over the wildfire risk that surrounds them. And so this is an introduction to research that I've started and will continue into the future in the area of public health and climate change. Thank you very much. I could not see my notes on that thing.
So our third speaker is Dr. Marie O'Neill. She's a professor of environmental health sciences and epidemiology, and whose research focuses on health effects of air pollution, temperature extremes, and climate change, environmental exposure assessment, and socioeconomic influences on health. Thank you so much.
Thank you. Thank you, Sue Ann. Can you hear me? Yes. So good afternoon. Thank you so much for having me. It's really an honor to be here. As an epidemiologist, I study determinants of health at the population level, for which we use imperfect data to describe patterns of association and then use those insights to inform policy action. I've been working on research on climate-related exposures, including extremes of temperature and precipitation, air pollution, and a variety of health outcomes, including birth outcomes such as preterm birth and low birth weight, for over 20 years. I also came to University of Michigan almost 20 years ago now to learn about community-based participatory research through members of the Detroit Urban Research Center. So my talk today will touch on both of these themes. And I'm trying a modified Takahashi method of presentation, so few words. So I'm first going to talk about heat, air pollution, and vegetation. So the main exposures that I've worked on have been air pollution and temperatures. My PhD dissertation used vital statistics data on daily mortality, census tract variables, air pollution, and temperature in Mexico City to evaluate the question of who might be more vulnerable to air pollution exposure. More recently, our work has evaluated the potential beneficial buffering effects of proximity to vegetation or green space on health outcomes linked to temperature and air pollution exposures. So my next point is that big data epidemiology is really essential. With increasing interest in climate change around the year 2000, I shared my Mexico City dissertation data set for the International Study on Temperature, Heat, and Urban Mortality, or isotherm, which evaluated how temperature impacted mortality in urban areas of 12 low and middle income countries. And what we saw was sorry, I guess the slides did it. But I'm promoting the School of Public Health at the expense of the data, but this is should be 12, but it just shows the heterogeneity we saw between temperature and urban mortality. So these combined multi-city studies to assess associations of climate exposures are invaluable for evaluating patterns of vulnerability to climate-related climate-related health impacts. But the evidence is skewed towards high-income countries, as I think we all know. The isotherm study, which was published in 2008, was an early attempt to increase representation of more low and middle-income countries in climate research, but the imbalance remains. More recently, I've gotten involved in climate-related study led by Ana Diaz-Rue and Daniel Rodriguez evaluating heat and health in a large sample of Latin American cities compiled for the Wellcome Trust-funded Salurbal study, which stands for Urban Health in Latin America. The project included evaluation of green space as a potential protective factor for heat-related mortality, and our 2023 publication showed some evidence that it was, but that the role it played really varied depending on climate zone. I'm now collaborating with Center Impact scholar Naziba Sadiqa, see her poster at 5:15 today, on work evaluating whether women living in areas with a higher amount of green space, as measured by the Enhanced Vegetative Index through satellite data, have reduced likelihood of adverse birth outcomes using demographic and health survey data. This map shows the survey clusters in Colombia from the year 2010. It represents over 20,000 births. And the results that she has on her poster, which also include Guatemala, show that this nature-based solution was protective of some of the adverse birth outcomes we see, and we plan to add more countries to this. So shifting gears, I want to also mention that housing obviously plays a key role in how these climate-related exposures affect our health. Many of us spend much of our time indoors, and the type and quality of housing that we live in plays an important role in protecting us from climate-related exposures and maintaining our health. The center is supporting some valuable work led by Center member Ana Paula Pimentel-Walker and colleagues looking at how self-built housing in informal settlements can help protect people from heat and heat waves. Additionally, since 2016, I and several others have been involved in community-based work in Detroit under the Climate Hazards Housing and Health Partnership with an energy justice focus. Earlier this month, we held a workshop on this topic at the Detroit Center that brought together many representatives from local government, nonprofit, and practitioners to discuss how we can work together to enhance both sustainability and well-being. And these are a couple pictures of the workshop. Finally, I'm going to end with the title of a recent commentary, Local is Global. My final point being that health disparities are everywhere, and it's really wonderful to have a center focused on global health equity. Anand and Pai recently argued in a 2023 Lancet editorial that global health training can also include action in local communities on populations within high-income countries. And the work in defining patterns of health vulnerability to climate change using big data from multiple countries must go hand in hand with the search for local solutions in equal partnership with affected communities, whether they be far away or next door. Thank you very much.
So our next speaker is Arun Agrawal. He's a professor of environment and sustainability. His research focuses on politics of international development, indigenous knowledge, institutional change, environmental conservation, and sustainability.
Thanks, Joe. Thank you for inviting me to do this lightning talk. I'm not a climate change and health researcher. I really mostly work on climate change. And I got into this field because Joe Kolas invited me to work on how do I move it forward? Work on a proposal about a year and a half ago. And for those of you who don't know what it feels like to work on an NIH center proposal, I have an answer for you. It feels like this. But at the same time, as he invited me to work on this, and I foolishly agreed to do so, I also found quite a few, in fact, many colleagues who really helped me think through what working on a center proposal should be about, which I learned, but not fully successfully, and which also then created in me a continued interest in working on health and health equity issues. And that has resulted in 2 areas of work that I'm now pursuing. And I will say that this shift to something specific in relation to global climate change and health equity has itself also been a process of trying to figure out what exactly working in this field is about. Because most of my work is supported by NSF or NASA, and there you begin with a cause, and you try to think about how that cause affects some outcomes. And I thought, hey, I'm interested in climate vulnerability, I work on climate vulnerability, I can get involved in some research on public health. And then I learned that no, that is not how the field of public health is organized. It's organized not by an analysis of causes, but by analysis of outcomes. So you focus on epidemiology, or maternal and child health, or cancer, or whatever. But if you want to work on climate change and health, you don't know where to go to support that work. And that would be very different in a field outside of public health. And I wonder, so I have a question for you, why is it that public health is organized by a focus on outcomes? If I think of business schools, they're organized to focus on organizational processes, not outcomes. If I think of social sciences, they're organized by a focus on causes, not outcomes. So there's a question in my head to which I don't know the answer. We have over the past year and a half been working on a number of different research questions. So we settled on these 2 questions of how is climate change related to birth outcomes, and how is climate change through conflicts related to health outcomes associated with conflicts. And for the first one, we worked with several close colleagues in a postdoc on health outcomes in Bangladesh, low birth weight outcomes in Bangladesh, and we found the analysis that we did with using DHS data, 2 main findings from that work is higher temperatures are associated with lower birth weight, which is a finding consistent with much of what the literature says, but much of this work is really focused on rich countries or higher income countries. So this is one of a few papers that's focusing on a lower income country. And the second, that the proportion of variance explained by climate change is a very small part of the total variance in birth weight. And so the question that this raises is, to what extent is climate change a present danger to health outcomes, not just with respect to birth weight, but also with respect to others? So when Jennifer was presenting her work, it's clear that climate change is clearly influencing valley fever in a substantial way already. But maybe that is not similar across different health outcomes. We're also working on a couple of review papers on climate change and birth outcomes, and we have 1 proposal that is currently in submission stage. We began some work on climate vulnerability and conflict in Africa and sociopolitical stability in Africa, which was funded last year. And now we are beginning to think about how we can extend the work we are doing on climate change, demographic change, and conflict in Africa, with coupling that with information about conflict-related health outcomes. So this is something that is still going on. We are working on developing some ideas and some arguments about it. And in conclusion, I would say that while Joe dropped me into a deep end to try to figure out what to do, there's also a whole group of people that came to rescue me and to rescue this project of working on climate change and health equity, in which I've been now involved for a year and a half. Thank you very much.
Thank you. So our last lightning talk speaker is Dr. Nancy Love. Dr. Love is a professor of civil and environmental engineering who works at the interface of water, infrastructure, and public health in both domestic and global settings. Thank you.
Thank you.
Well, good afternoon. I'm going to talk, I gave a talk last year that was more related to my research specifically. I'm going to give a broader talk today. Now, I'm going to start with talking about cities. Cities are engines that drive economic prosperity in countries. And in Ethiopia, where I have international collaborations for over a decade, despite mostly an agrarian economy, today, nearly 1/3 of the country's economy is linked to the urban centers, and continued rapid growth is expected. Creating healthy, livable conditions in cities is critical to any country's future, and having effective water and sanitation, what we call WASH, systems is mandatory for dense, healthy living. Without it, we cannot have cities. The approach to WASH developed in the US and other high-income countries, they developed in a very different way and at a different time in history. And so while Western WASH solutions have brought tremendous successes to us, we also know, but tend to speak less about, the failures of our large-scale urban water systems. Core aspects of Western urban water systems are unsustainable. For example, in the United States, we use about 10 to 15% of distributed water for truly potable, drinkable purposes. Yet we treat 100% of the water distributed to us to potable standards, and we use it to flush our toilets and put out fires. These systems are inflexible and cannot remain functional in the face of our changing climate. The demands for change are coming faster than the pace at which we planned to replace our 20th century systems. And so given this context, let's look at the situation in Addis Ababa, Ethiopia, which is Ethiopia's largest city and the fastest growing economic engine. Addis is in East Africa, you see the map there, and it reflects the situation in other major low-income, rapidly growing cities that financiers have implemented Western-style centralized water infrastructure in over the past several decades. Here's the status today. The graphic on the left shows the number of times per week that treated, distributed drinking water is available to users across the city. The dark regions show water provisioning 6 to 7 days a week, but with frequent power outages that prevent pumping and loss of at least 40% of treated water. Fresh water is not available anywhere in the city 24/7, 365. Most of the city is getting water to 3 to 5 days per week. Why? The capacity of the system is about 40% of the demand. That assumes 100 liters per person per day, which is about a quarter of what our demand that we enjoy in the United States. The current Band-Aid to improve affordable water access through storage, which reduces water quality and enhances health risks to users. Furthermore, in Addis, the newly constructed and vastly upgraded Western wastewater system supports less than 10% of the city's population. My 30-year career in the domestic and international water industry has brought me to identify 3 challenges that need bold solutions. The first is climate change is making loss of accessible freshwater resources worse in a city that already doesn't have enough. I flew over eastern and southern Ethiopia in January just a couple months ago and repeatedly saw dry or drying reservoirs and rivers throughout the country 4 months before the rainy season. The conundrum of an already stressed urban water system will get worse, and irrigation water for the agricultural center of the country is facing the same fate. Innovative water resource management practices are needed to distribute water better and to enhance the efficiency of water use. Second, strictly centralized water systems that are constructed to last decades are notoriously inflexible. They are not climate resilient, and they cannot alone address the water stress challenges of Ethiopia's cities. Decentralized water infrastructure that brings some level of on-site purification or novel approaches to waste management and fit-for-purpose treatment, which means where water is treated in accordance with its planned use, have long been dismissed as too expensive or not adequate for maintaining public health in Western conversations. But modern transdisciplinary approaches are showing that this conventional wisdom is not true. This brings me to 3. Effective and life-saving innovation requires truly transdisciplinary approaches to succeed with numbers 1 and number 2, and some of my points overlap with prior speakers. It can enhance in ways we've never seen before the use of data-driven solutions. Policy change, risk analysis, education, workforce development, and business models, coupled with data-driven technologies, are just the start. We need not only better ways to capture useful data, but also novel approaches to render water quality and water abundance data in ways that are both practical and support decision-making, especially local decision-making. Without this, the future of Addis Ababa and other similar low-income dry region cities that are the economic engines of their countries are highly uncertain. So this explains why I focus my scholarship, my educational efforts, and my outreach efforts around this space. I focus on approaches that enable local decision-making, support local knowledge creation to enable sustainable decisions, and create the local professoriate to build a sustained educational infrastructure. 3 of my former students I've co-advised in Ethiopia are the first environmental engineering faculty in the country. I'm grateful that we're educated in Ethiopia, I should say. People have been educated outside, but most of them, or many of them, don't come back. I'm grateful for programs that seed funding to launch scalable partnerships towards this end. At the same time, I believe that we as an institution, U of M, need to identify how to find a balance between directing our resources towards ourselves versus towards our poorest partners who are battling climate impacts driven by our historic privileges. Thank you.
Oh, don't sit down. I want to invite
Right.
our speakers to sit and oh, wait. Because you were so prompt and finished your talks on time, we have plenty of time to chat. Okay, so I want to just start this off by talking about how we've been, or the field has been working on climate change and health for decades, and it's really been recent that we've seen this big increase in activity, largely because of the urgency of climate change and health that we're seeing right now. And so the first question is really, what are the important ways forward in climate change and health work research? And if so moved, what can we do at U of M specifically with respect to moving forward? And this is actually questions to all of you, so. Go first.
I was going to say that there's really an enormous amount of work that is being done on climate change and health now. So when we were doing the center proposal, I think in 2000, there were roughly 80 articles on climate change and health. And in 2020, there were 7,500. So I don't think we can compete with the field by publishing more. I think we have to emerge as a place that brings together and connects people who are working on climate change and health. And I think the Center for Global Health Equity is especially well positioned to do that because of its focus on equity and vulnerability, which is really what climate change, to my mind, is all about when it comes to its health impacts. Because the rich and the powerful and the wealthy, they're going to figure out what to do. You don't need to worry about them, about climate change and health.
You know, when I first started working internationally, I remember feeling very overwhelmed with all the challenges and feeling like anything I did wouldn't make a dent. And I felt I had to get over that, because all of us contribute something. And so I think that in this space, which is such an enormous challenge, we all have to accept our space and our knowledge base and focus in on that and do that work well. And again, I hope that within U of M, we working, I guess the transdisciplinary point about working together, but also finding ways to support our neighbors, our partners who often don't have the resources in their countries to match grants and things like that some of our federal agencies want. So I think the center is finding ways or looking at ways to make sure that we can do that work collaboratively and in a user-centered design approach, which I think is really, really important. But keep the faith that the work you offer, I think for all of us, is important, that space. Just focus on your expertise and how to bring that to the larger collective.
A critical point, because I think that otherwise you get overwhelmed. The trick, I think, is to figure out how to work across disciplines, since each discipline has their own way of
Cultures. Mm-hmm.
Yeah, so based on I guess my own path, I think, is an example of how climate change and health has advanced. I come at it from a human adaptation to climate change perspective. I'm not a public health scholar. My research all focuses on behavioral adaptation to climate change, but when you think about what adaptation is, it is the process of making adjustments at whatever level of organization. So I focus more on individuals and households, but it can be at organizations, institutions. It's the process of adjustment to reduce risk and increase well-being or welfare or suitability to the environment. And so the whole field that really comes more out of, I think, human environment geography has focused on that process. But what is well-being and suitability if not measured by, with indicators of public health? And so now I think those two fields have really come together. And so I think for me, having come at it from an adaptation perspective, but now realizing I have to draw on the public health literature and collaborate with public health scholars shows how these different fields are coming together to address this really complex but common problem.
Yeah, and I think going off of that, the adaptation angle, I think is being seen more and more in the field of climate and health. I think a lot of early research was intending to bring to light some of the challenges of climate change on health, and a lot of the more research now is recognizing that the relationships between climate and health can be very differential based on socioeconomic status and access to vegetation and a variety of other characteristics, and these characteristics that modify those exposure response relationships can then be the, give us ideas of what we might act upon for adaptation measures. I think going back to what you said earlier, Joe, about working with other fields, I think that's also something I've seen more of, working with climate scientists, particularly for climate projection work, as we have access to better and better tools to project climate change in the future. I think we're seeing more projections so we can kind of better anticipate what health effects might be in the future. But certainly there's more work that needs to be done there.
Yeah, we had an excellent talk last week from Taylor Ricketts, who basically said the very same thing, coming from an ecologic perspective, that thinking about climate change, that public health and health was the right currency to really be looking at. So it really does bring examples of how different disciplines can come together to inform some of this work.
At least I'll just say that I think one of the things that is commonly said about climate and health research and data is that what we see is climate change related exposures are amplifying existing inequalities. And I think that, yes, there's a need for data to inform adaptation, but there's also a need for action that may not necessarily need an innovative new research method, but rather an innovative new way of partnering and having research be community-driven and, the wisdom of people who are living in impacted areas, be brought to bear in the same way that whatever wisdom those of us trained in an academic discipline have to offer, can do as well.
We've talked a lot today in the lightning talks about research, epidemiology, but this question is about building resilience. So in thinking about climate change and health work, have we moved the needle forward on building resilience? And if not, what are some of those ways forward, especially emphasizing issues of equity and justice? And then, if not, if the answer is no, we haven't, what can we be thinking about at UM and CGHE to lead the way forward?
I kind of have, I question the assumptions of that question, I guess. I wonder if resilience is really what we should be focusing on. I mean, when we're thinking about climate change, those are long-term changes in our environment that arguably we need to either, mitigate or adapt. And yes, we should be able to, be resilient, depending on how we define resilience. But, I'm thinking about it as like bouncing back and kind of regaining stability so that we can then continue along a trajectory or a path towards adaptation. And so we do want to be resilient to sudden, perturbations, sudden natural hazard events. But that's not the end, or shouldn't be the end point in my view. I think we should really be striving in the context of climate change for adaptation, learning to not just cope, but live and, arguably even thrive despite changing climate conditions. So I just wonder if we should be focusing just on resilience, and if not, focusing more on adaptation.
What do you mean by resilience?
Yeah.
Joe and I talked about this before this question about kind of the fraught nature of the word resilience, and especially when we're thinking about building resilience, which is building back better. Like building back better for who? Who are we thinking about when we're bouncing back and building back better? And I think that's an important part of this question.
I learned the fraughtness of that term when I worked on a proposal across disciplines, and every one of us had a different definition for that term. I think I agree with the adaptation is really critical. And, at the same time, the pace, I work in very slow changing, long-term infrastructure systems. And we design for 50 years, right? And so everything we build today will be with us towards the end of the century. And so we don't have time right now to wait for bold shifts. So that's, I think, become a bit urgent in all the infrastructure money that we're going to be investing and post-pandemic kind of funding that's happening across the world. We're building 20th century technologies still. And so and I think that probably pans out into other infrastructure systems or critical infrastructures. And so to me, that's an urgent element, and the change, again, is not just a technical one. It is a policy, it's financial, it's human-driven. There are so many different factors, which is why the true transdisciplinarity and is really needed, and new approaches. I'm in a class now on this with NSF and their TIP program, and it's intense, but very helpful to rethink, what we as academics and our role may be and how we can contribute to that. So I hope U of M can pick up on some of those activities and bring them to campus.
I would say it's hard to answer whether we move the needle on resilience. Well, first of all, because of the definition, but I think it varies where you are. But I do think moving forward, connecting areas, even within this campus, there are lots of smart people in engineering working on renewable energy, but not necessarily connecting that to, the redevelopment of a public housing project in Detroit, where they really could, that would reduce energy burden and things like that. So I think making these connections across our campus, and I think the center does a great job in doing that, is one way that we can learn about what other people are doing. Even conversations that go on, biodiversity and nature-based solutions, we're kind of talking about the same thing, but sometimes in silos. So I think building, moving the needle on that involves us kind of realizing who else is doing what and how those technologies or approaches can be used for adaptation.
So I would probably say, in answer to your question, that we have not moved the needle. If anything, we have gone backwards. And the reason I say that is because if you look globally and estimate what's happened to inequality, it has declined. But global decline in inequality is really an artifact of changes in national level average incomes. And it's driven primarily by what's happened in China and India. If you look at inequality within countries, there are very few countries where it has declined. And to me, an increase in inequality is a symptom of a decline in resilience. And this is driven not just by changes in income levels, but also changes, much more importantly, in assets and wealth. And those are the real backups for trying to create resilience among different groups of people and across people. The second thing I would say is that, the question, it's not just resilience that's a fraught word. You have actually invoked three fraught words: resilience, equity, and justice. And equity and justice are in vogue, and we talk about that much more right now as opposed to 5 years ago. But I wonder to what extent we have done really anything about equity and justice. And without achieving greater equity and justice, there is no greater resilience. So, and then, Paige, I agree with you that there's a difference between adaptation and resilience, but most scholars of resilience would say now resilience is about bouncing back better. It's not just bouncing back, it's bouncing forward. And in that sense, some of them might argue that to be resilient is, in fact, to be more than adaptive. It's like when you are resilient, you are not just thinking about what you had and what you have as threats to your well-being or threats to ecosystem well-being, but what you will have in the future. And without that being part of what you're trying to do in response to threats, in response to shocks, you are not being resilient. So to my mind, the answer to your question is, first question is clear, that we have not enhanced resilience either globally or locally. And the second question of what role do equity and justice have to play in it, in my mind, it is not just analogous, but it's synonymous with resilience. Without justice and equity, there is no resilience.
I can add to some of that from the perspective of infectious diseases. I really appreciate all the viewpoints here. I think I might take a slightly more optimistic approach to the first question of how we built resilience, at least in terms of emerging diseases. I think a lot of times the adaptation measure is tough because a disease is emerging and we don't have the right therapeutics or vaccine candidates for it. And through great scientific advancement, including by work done by researchers here at UM, we're getting closer to that. And so I do see in some disease systems paths forward to build resiliency for climate and health outcomes. But then, of course, the counterbalance to that, going off of the equity and justice angle, is are we getting those therapeutics and those vaccines to where we need them to be? And of course, as we've all seen from the example of the SARS-CoV-2 pandemic, once we had great scientific breakthrough in making the vaccine, we maybe didn't have great scientific breakthrough in getting it into the right communities or even into the right countries. I know there's still countries that don't have access to the same vaccines that we have in the US. So I see scientific progress in building adaptation, but maybe not always equity in terms of distributing those adaptation measures.
So last question. We've been talking about, we're talking about transdisciplinary and activities and different languages that we're using and different approaches we're doing. Arun, you talked about how public health does things differently than other fields. There is a distinction, and we've had this discussion before, between climate variability and climate change. And I wanted to hear some of your thoughts on what is that difference and why is that a meaningful difference to be thinking about the two?
Health outcomes or just in general?
I'm thinking, yes, with respect to health.
Yeah, I think I should let those who know public health better than me speak to this, because I often have views.
You have opinions.
I have opinions which are very, very well formed, but often that they should be leavened by facts.
Well, I guess I would say in part, they're wrapped up, with climate change, we're seeing increasing variability in weather and increasing, drought to extreme downpours to, crazy swings in temperature, which we're even seeing in Michigan, that affect crops and food and people's health in that way. So I think in a way they're related concepts, and even in the temperature field, people look at diurnal variation in temperature and how that impacts people's physiology. So I think we have to study, climate change is on a longer term time frame, of course, than weather impacts, which is a lot of what people kind of label as climate-related exposures, but we are looking short term. But I think that variability is really important for health, even the fungal diseases, what's happening when you have really dry, you have droughts and the fungal spores are released in a way that they hadn't before. So I'll start and pass it on to our fungal expert, maybe.
Yeah, I guess definition-wise, climate variation is just day-to-day differences from the mean, whereas the climate change is a longer-term shift. And usually when we start by looking at the association between climate and a health outcome, we start by looking at climate variability, because that's the variation we're harnessing in our statistical models to see how that explains variation in the health outcome. And then it's a harder challenge to actually relate that variation to climate change and to say this change in the health outcome is attributable to anthropogenic climate change. And I think there's some exciting, at least work I find exciting, partnerships with climate scientists that are able to actually say this is the counterfactual time series for temperature that would have happened if we subtracted anthropogenic forcing from the historical time series. And then we're able to start saying, okay, now we can actually attribute this many preterm births to climate change, or this many cases of fungal infection to climate change. So I see that as exciting, to sort of starting to move from variability to climate change in terms of attributing and really like counting up the true impacts of climate change. And hopefully using that information to garner support for policy and better adaptation.
I think the distinction is important, and that efforts, should be focused on both. And when we think about, helping individuals understand what protective actions they can undertake, we have to recognize that at the individual and household level, people are responding to climate variability. They're, to the extent that they're making decisions about how to behave in the future based on past experience, they're doing that, based on their experiences of climate vulnerability. And so autonomous and kind of incremental adaptation efforts are going to be responding to climate variability. So it's the role of institutions to help individuals understand the long-term, climate change patterns so that they can really help people make, decisions in anticipation of future change. And so I think it's kind of, one reason to think about the difference between those two is that, it's individuals and households are going to be responding to one, but it's the role of institutions, including us as scholars, to help people learn more about the other, so they can respond in an anticipatory way to that.
Yeah, I think one thing I just think about in terms of variability, again from a engineering design perspective, we often design based on historical data, and we have design curves and things that have been based on the world 50 years ago or whatever, and a lot of those haven't changed, and a lot of the infrastructure in place is based on that information. So we're seeing this dramatically with flooding, right? But it's going to be manifesting in other ways as well. You see with energy systems and so forth, all our public service sectors are based on historical data, and the variability is not linear, right? I think it's non-linear. So that's, I think, a big challenge to figure out how to predict that uncertainty.
I think we're going to have to ask Arun on a one-on-one basis about his opinion as we ran out of time. I want to thank our speakers for enlightening us about their work and also about these thought-provoking questions. And next up is going to be a panel discussion on moving forward with respect to what universities should be doing. We're lucky to have 8 luminaries in global public health to talk to us about these these ideas and their thoughts about this. So I think we have 10 minutes or so as a break, and so I welcome you to stretch a little bit, and we want everybody back at 4:10 so we can start promptly at 4:15. Thanks.
Thank you, Joe, Sue Ann, and the panel.